Welcome to How to Measure the Magic of Prevention and Avoid Spreadsheet Hell. Hi, I'm Allison Heller-Ono, President and CEO of Worksite International and the creator of the Ergo-Case Tracker. This demonstration will provide insights about why measuring your ergonomics process is critical and how to avoid spreadsheet hell by giving you a cloud-based software solution to track and measure your ergonomics process easily and effectively while preventing injuries. A few quick housekeeping items before we dive into this e-webinar demonstration. After this webinar is finished, you'll have a chance to schedule your live one-on-one demo with me to explore all the Ergo-Case Tracker offers and opt into a 30-day free trial to see if the Ergo-Case Tracker is right for you. So after you're done, let's schedule a time to talk about how you can improve your ergonomics process with better tracking of each case and the resulting metrics. Let me start with sharing a bit about Worksite International before I go into the agenda. Worksite International supports small to mid-sized organizations all over the world by providing solutions for a healthier workplace. Our solutions improve employee performance and organizational health using the science of ergonomics. We offer evidence-based and results-oriented services like the software we'll be demonstrating today for you. As the founder, CEO, lead ergonomist, and software creator at Worksite International since 1993, we've delivered on our mission by bringing our clients the latest in ergonomics process design and management technology. Our services and products are backed by 3 decades of research that have been peer-reviewed by international academic researchers, ergonomists, the Oxford Research Institute, the California Physical Therapy Association, and our clients. In this session, I'll be sharing some of my research results as it applies to ergonomics process design and using the Ergo-Case Tracker. Over the years, our services are most often used by ergonomics managers, Ergo-Specialists, EH&S managers, safety managers, health and wellness managers, and others, including human resources and risk managers. Basically, companies who want to achieve best practices in ergonomics process design and management. I look forward to learning more about the role you play in managing your ergonomics process. This info-packed webinar demo is based on Worksite International's 3 decades of research on the theory and practice of ergonomics process implementation. Now let's go over what we'll do in today's session. We'll cover the power of the ergonomics process in driving ergonomics organizational change, ergo process readiness and what it is, the importance of measuring your leading indicators, and how the Ergo-Case Tracker works to support all the above. Let's start with the elephant in the room. Work injuries cost U.S. businesses billions of dollars a week. The Liberty Mutual Safety Index from 2023 highlights the top incidences and their cost to employers. Top workplace injuries include overexertion from heavy loads, falls to the same level or lower levels, awkward postures, and repetitive motion. Regardless of the cause, these incidences likely result in musculoskeletal disorders, which are amenable to ergonomic evaluation and mitigation through an active ergonomics process. Many of these are preventable using the science of ergonomics. Is your organization concerned with the prevention and management of work injuries? What are you doing to prioritize musculoskeletal disorder prevention for your company? I imagine that's one of the reasons why you're here. To bring this home, the average cost of a workers' compensation injury like back strains, sprains, carpal tunnel syndrome, neck injuries, all of which are usually musculoskeletal disorder classified, is $42,000. You likely could spend about $1,000 per worker to cover this one injury claim. And this is consistent with several sources like the National Safety Council and the State of California Division of Workers' Comp. Do you know your company's average work injury cost? And even if you don't have any work injury claims, employees still have symptoms or medical conditions that affect their productivity and your bottom line. Over the years, I realized workers' comp claim frequency and costs are like a barometer, a measure of an organization's internal health. But if you don't know what these numbers are, the costs, the frequencies, the trends and causes, then you're left wondering how to manage them. You might wish you had a crystal ball to mitigate musculoskeletal disorder risks so you could see them coming and then minimize or even avoid them. The reality is you just need good data. If you can measure it, then you can manage it. Do you wish you could more easily measure your risk proactively? Well, in just a few minutes, we're going to look into my crystal ball and I'll show you how. To mitigate MSD risks, companies must be proactive, value prevention, employee well-being, and track predictive measures, otherwise known as leading indicators, that monitor and provide information about the activities, impact, and performance of an ergonomics process. To represent the influence and the impact of ergonomics on organizational health, safety, and well-being, we created the Worksite International Ergonomics Process Influence Model. It shows the interplay between the individual and the organization and the role of ergonomics to influence well-being, safety, workers' comp and disability on organizations, along with the influence and impact it has on information technologies, facility planning, and purchasing. Ergonomics drives change in all these industries shown here, whether you work on-site or remotely or have a hybrid workforce. Ergonomics drives change in an organization when it is integrated into these department policies, procedures, and actions. Our research shows an effective ergonomics process includes the 6 pillars of ergonomics process management. Let's go over each one of those. The first pillar is communication, being able to actively engage employees in your ergonomics process through a variety of different ways of communication. Second pillar is employee participation. Using a participatory approach to your ergonomics process will yield valuable results. Performing ergonomic evaluations is pillar number 3 and a vital component to any ergonomics process. Pillar 4 is solution implementation that includes providing purchases, engineering changes, administrative actions, and training. Pillar 5 is ensuring that management and employees are accountable and follow through with the actions recommended. And finally, pillar 6 is tracking and measuring your outcomes. Our Ergo-Case Tracker addresses this last pillar to help you manage your process better. We will be getting into the demo in just a few minutes. Let me first explain the Worksite International Ergonomics Process Flow Model recommended, which aligns with every employee's ergonomics evaluation journey. This model is part of the Worksite International Ergonomics process. It aligns with the 6 pillars I just discussed. It represents the employee's ergonomic evaluation journey from the time an employee requests an evaluation to the time the case is closed or implemented. Each of these actions through the process flow is a milestone in the ergonomics process and a leading indicator associated with it, being proactive, preventive ergonomics process. Each has value. Tracking this value as a metric, a cost, a measure of time is critical to your success. From our research, many companies take a transactional approach to ergonomics. A transactional approach occurs when your ergonomics program only affects one person at a time on an as-needed basis. It lacks integration into the day-to-day decisions made within your organization, like in the Ergo Process Influence Model. Unlike when you take a systems approach to ergonomics, as our models recommend. In our latest research conducted over the last 3 years, we've been measuring how ergo process ready companies are. Our research tells us organizations just aren't Ergo process ready to implement the 6 pillars and the Ergo process flow I just showed you. In our most recent study, out of 20 small to mid-sized companies in all industries across the country, a majority of companies showed limited readiness when it comes to ergonomics process management. We used an 11-point readiness scale as shown on the screen, and most score between 1 to 7 points, indicating they lack the essential components of a robust ergonomics process. We had to call the authorities and get many clients the help they needed. How do you think you would score? If you want to know, scan the QR code here on the screen and take our Ergo Process Readiness Survey, and we will create a scorecard just for you and review it with you. Our research tells us about 50% of organizations don't have an ergonomics process policy, and if they do, it doesn't go far enough. An ergonomics policy serves as a game plan for all involved and includes roles and responsibilities, evaluation procedures, what should happen, who's responsible for what, and much more. We work with our clients to create a custom ergonomics process policy that aligns with their culture and goals. It's a game changer. Does that interest you? Our Ergo process readiness research also tells us that 58% of companies lack internal qualified expertise to support a robust ergonomics process. If that's the case, then who's performing your evals and keeping track of each employee's journey from the time of request to case closure? What's your accountability process look like? Our research tells us 70% of organizations don't routinely track Ergo process metrics and return on investment effectively either. They don't track or measure Ergo program activities like evaluation costs, training, or purchases. This results in a challenge when you want to ask for money for new chairs, electric desks, or invest in training or budget for additional ergonomic services. Just by attending this webinar, I imagine this is a top interest for you. Everyone wants to know where the money is. Our research tells us 67% of companies don't keep an annual ergonomics budget dedicated to Ergo program needs and costs. This results in a challenge when you want to ask for money for Ergo solutions. And this goes back to your policy details and metrics tracking. No policy, no accountability, no numbers to justify your investments, no budget, then what's the person to do? Our research tells us companies need 3 components for a successful ergonomics process: having an approved ergonomics policy, having an internal ergonomics specialist or ergo consultant to track, measure, and monitor your process, and the third key is documenting employee requests and subsequent actions. Tracking your ergonomics process actions are the key to your success. Now, you may track some indicators, but tracking the leading indicators is what helps you prevent injuries. If you track claims frequency and costs, these are referred to as lagging indicators. That means you miss the chance to prevent the incident. You need to track the right data associated with the employee's evaluation journey, such as the reasons why they need help, the location, the associated costs, the metrics, and return on investment to measure your success and prevent injuries. Does your Ergo data look like this? Mine did. I called it spreadsheet hell. When I was the ergonomics manager at a large government agency with 4,000 computer users, this is what I used to keep track of all the evals we did every day for all our computer users. We evaluated between 150 and 300 people a year. I really needed the Ergo-Case Tracker then. You'll see why in a minute. I really struggled with this Excel spreadsheet. I just didn't know how to add formulas, do pivot tables, or produce graphs and charts easily, and it was very tedious to use and frustrating. Whether you use Excel, Smartsheets, or some other manual tracking method, do you wish you had a better way than what you're using now to track your ergonomics process? More importantly, you need better data to justify your program costs to management. Show them the value, and as they say, show them the money. That's why I created the Worksite International Ergo-Case Tracker to measure the magic of prevention. So people like you and I don't have to struggle like I did when I managed the Ergo process that supported 4,000 computer users and 1,000 others with industrial evaluation needs. I want to get you out of spreadsheet hell. The Ergo-Case Tracker is just what you need. It's designed for anyone responsible for ergonomics and employee well-being in small to mid-sized enterprises where you do between 20 to 50 or more ergonomic evaluations a year. That could be office evals, chair fittings, workers' compensation evaluations, and even industrial evaluations. And it's great for consultants too, to track for their clients. Let's begin the software demo now, that you understand the value of an ergonomics process and why tracking your leading indicators is so important. The primary features behind the Ergo-Case Tracker that will give you a powerful tool to measure the magic of prevention are tracking new ergo cases, tracking all your ergonomic cases, developing metrics, reports, costs, return on investment, and more to share with leadership, and setting case reminders for milestone events through the process so you never drop the ball on your employees. First, let's begin our demo with the home page, where you will see the 4 primary functions. The first function is putting in new ergo cases. So every time you get a request, you can enter new ergo cases. You can track all your cases year to date and total. You can click on all report options, and you can set milestone reminders. The home page also indicates in these boxes, the red colored is the number of evals you need to schedule. This is all the evals that you've scheduled and performed year to date and beyond, all total evaluations that you've performed. The green box is your return on investment calculator, and the red box here in reminders is those all reminders waiting for your attention. This is the highlights of the home page, so when you log in, you know exactly where you are at any moment in your process. An important part of your process is having one gateway into your ergonomics process for employees. We recommend using our inclusive Ergo-Case request form for all your employee ergo evaluation requests. Once the employee completes the PDF form, as it's shown, they submit it to you for auto upload into the Ergo-Case Tracker, starting each case with the initial data. No hassle, easy peasy. The Ergo-Case request form makes your life so much easier because no matter what level you invest in, it's included and is recommended for use to support your ergo process. Now, after you upload the Ergo-Case request form, it easily adds the employee's case request and other data so you can identify the employee's why, along with other essential leading indicators to start the initial case data entry. This is a critical metric to validate your early reporting process and track results. It also allows you to appropriately triage the type of evaluation you need to perform. So knowing your employees' why, the reason why they are asking for assistance, is a critical leading indicator in your ergonomics process. Once inside the employee case, you will track based on where the employee is in their journey. After you enter the initial data, as I just showed you, you can enter purchases from the approved report along with the costs. You can enter different ergonomic trainings that have been recommended and assigned for the employee. You can include when the report was distributed and save the report into the case. You can track employee risk pre and post so that you can demonstrate a reduction in risk assessment for each of your employees benefiting from ergonomic evaluations. You can track after implementation, like if a follow-up is needed and when the case closes. And you can even track workers' comp conversions if a case converts from prevention to a claim. So much value in tracking through the employee's journey. And as you enter each new case, you begin to build your all case database as shown here. View all your Ergo cases at once, up to 100 on a single page. As an upgrade, you can organize your database the way you like it and save that for future use. The pencil here allows you to click each personal case and work directly on it as previously shown. And ask about all our other upgrades when we meet after the webinar demo. Importantly, you can set up and track reminders for critical milestones along the employee's ergonomics evaluation journey, like when to schedule or check on purchases or do a follow-up, ensure the reports have been reviewed and signed, and much more. This ensures you will never leave anyone unaccounted for through your ergonomics process and ensure you move the case to closure, saving money and reducing injury risk. After, you'll mark the reminder complete and it records it in the employee's case journey. When it comes to essential reports, the Ergo-Case Tracker has you covered. Measure your results over time, share reports with management, view evaluation case counts by person and type, measure program costs and monitor it, manage average investments, and view return on investment. Show leadership how much your program costs and the return on investment your ergonomics program delivers every year. Using our pie graphs and bar graphs, you can track the reasons why employees need ergonomic evaluations, see how your program is being used by various departments, trend your purchased items and costs, and much more as visualized here. In summary, when you use the Ergo-Case Tracker, you can measure the magic of prevention. The Ergo-Case Tracker is magical. It builds your legacy program for years to come and demonstrates ergonomics as a sustainable process for your organization, long after you move on and others take over. I thought after I left my government job as the ergonomics manager that the process I created would fall apart without me, but I'm glad to say I was wrong. It's thriving more than a decade later based on the theory and methods described here. Using the Ergo-Case Tracker demonstrates the value of your efforts through metrics tracking and shows the ROI of your process year after year, improving organizational and employee health, well-being, and much more. Now, how valuable would that be for you, and how magical would you feel? So here's some feedback from our clients who are stoked to use the Ergo-Case Tracker. Serene F., a wellness program manager for a large medical device manufacturer, said, "The Ergo-Case Tracker software is user-friendly and allows me to be far more organized than with the Excel spreadsheet we used to use. I also love being able to list the costs associated with the evaluation, demonstrating how my time is valuable in this process, tracking our purchases, and training by department, and so much more. It's so helpful for management to see who's having evaluations, why, and the cost benefit." Thanks so much, Serene, for your feedback. Another client, Nicole A., who's an ergonomics program manager for a very large healthcare organization, stated, "The software has everything ergonomic managers need to be successful to speak to the corporate demand of evaluations while being able to answer what is this costing and what is it saving the company. Most softwares don't have this at all." You're right, Nicole, they don't. You can hear more of Nicole's impressions over on our website. In addition, the Ergo-Case Tracker is great for consultants. Listen to more consultant testimonials and how they help their clients track evaluations performed, demonstrating their value over on our website. There's never been a better time to start tracking your ergonomics process success. Take the next step after this session is done. Schedule your deeper dive into how the Ergo-Case Tracker will benefit you and your organization or your clients. Whoop! It's easy to get started with our 30-day risk-free trial by selecting the program that matches the number of evaluations you perform every year. In addition to our startup package of 50 cases a year, you can select our small biz program if you do from 50 to 150 cases a year, or our corporate package if you do more than 150 up to 300 cases a year, or our enterprise package for more mature programs with multiple sites and multiple evaluators. Come and start your 30-day trial after we meet so I can show you how much more value this program provides. Visit the website to learn more about the features and benefits of each program. You'll also receive a free bonus for attending today, our Ergo-Case request form, which you can start using right away for your employees to request evaluations. It works with or without the software. Check your email after the webinar for details. Are you ready to end spreadsheet hell and start measuring the magic of prevention? Sign up for your exploration demo and begin your 30-day risk-free trial. Head over to our website for details or scan this QR code to get started. Once you enroll in the trial program, you'll be asked to complete our software license and an application so we can promptly set up your account details as soon as possible to get you started. There's the link to the software page to learn more. I hope you enjoyed Measure the Magic of Prevention and the Ergo-Case Tracker demonstration. Now head over to the website to learn more about the benefits and features the Ergo-Case Tracker offers and start your free trial. Thank you so much and have a safe day.